Do you know what pulmonary fibrosis is and how it affects your lungs? Pulmonary fibrosis is a lung disease where the lung tissue becomes thick and stiff or scarred over time. Think of it like the lung's response to an injury, akin to how a scrape on your skin forms a scab. But unlike a scab that eventually falls off, leaving fresh, healthy skin underneath, this scarring in the lungs is permanent. As the lung tissue becomes more scarred, it becomes harder and harder for the lungs to function properly. The end result? Less oxygen is able to move from the lungs into the bloodstream, leading to less oxygen for your body and brain. This can cause shortness of breath, especially during physical activity, and other symptoms that can significantly impact your quality of life. Knowing what pulmonary fibrosis is just the first step. Let's move on to what causes it. Ever wondered what might cause pulmonary fibrosis? Pulmonary fibrosis isn't picky. It can be triggered by a variety of factors. Let's dive into it. Firstly, occupational hazards can be a cause. When we breathe in harmful substances like dust or fumes at work, these can damage our lungs and lead to fibrosis. Medications, too, can play a role. Certain drugs, like some antibiotics or heart medicines, may cause damage to lung tissues. Ever had radiation therapy for cancer? That could be another trigger. Radiation can cause injury to the lung tissue, leading to fibrosis. Autoimmune diseases like rheumatoid arthritis or lupus can also contribute. These conditions cause inflammation that can affect the lungs. Lastly, genetics can't be ignored. Some of us may be predisposed to pulmonary fibrosis due to our family history. Understanding these triggers is key to managing and preventing the disease. Now that we know the triggers, let's delve into the symptoms. What signs should you look out for in pulmonary fibrosis? You might be wondering. Well, the symptoms aren't always obvious at first, but they become more noticeable as the condition progresses. One common sign is a persistent dry cough that just doesn't seem to go away. It's often one of the earliest symptoms, and may be accompanied by shortness of breath, even when you're at rest. This isn't your regular panting after a sprint. It's a constant struggle for air that can make even simple tasks feel exhausting. That brings us to the next symptom, fatigue. People with pulmonary fibrosis often feel tired all the time, regardless of how much rest they get. Along with this, they may experience unexplained weight loss. It's not a result of dieting or vigorous exercise. It's an unexpected drop in pounds that doesn't seem to have an obvious cause. Lastly, aching muscles and joints may also be a symptom, adding to the overall discomfort. Understanding these symptoms is vital, but it's equally important to know what happens inside your lungs. Have you ever thought about the role of inflammation in pulmonary fibrosis? Let's delve into that. Inflammation is our body's response to injury or infection. However, when it comes to pulmonary fibrosis, inflammation isn't a fleeting visitor. It's more like an unwelcome tenant that overstays its welcome. This chronic inflammation in the lungs can lead to the formation of scar tissue, a process known as fibrosis. Now, our lungs are built for flexibility. They need to expand and contract with every breath we take. But scar tissue? It's stiff, it's rigid. It's like attempting to inflate a balloon made of cardboard. This scar tissue impedes the lung's ability to function properly. It reduces lung capacity and makes it harder for oxygen to pass into the bloodstream, which our organs need to function optimally. Inflammation is a key player, but how can we manage it? Stick around as we delve into that in the next scene. What can be done to minimize inflammation in pulmonary fibrosis? That's a question that many of those affected by this condition have. Well, the answer lies in pulmonary rehabilitation that incorporates several strategies aimed at curbing inflammation. First off, we have physical exercises. They help improve lung function and decrease inflammation. Regular, gentle exercises like walking or swimming can be beneficial. Then there's the role of nutrition. A diet rich in anti-inflammatory foods like fruits, vegetables, fish, and whole grains can help manage inflammation. Another aspect is medication. Certain drugs may help control inflammation and slow down the progression of the disease. Lastly, breathing exercises and techniques can be a game changer. They can help clear the lungs and reduce inflammation. Remember, each person is unique, and what works for one might not work for another. Therefore, it's important to work with healthcare professionals to develop a personalized plan. Reducing inflammation is crucial, but what about the scar tissue already formed? Let's focus on how pulmonary fibrosis hinders airflow. The lungs, in their healthy state, are like sponges, flexible and capable of expanding and contracting with ease. But when pulmonary fibrosis steps into the picture, this changes. The disease leads to the formation of scar tissue in the lungs. This scar tissue is stiff and thick, unlike the elastic and soft, healthy lung tissue. As this scarring progresses, it makes the lungs increasingly rigid, reducing their capacity to stretch and take in air. This essentially obstructs the airflow, making it difficult for your lungs to take in enough oxygen. As the lungs fight to draw in air, you may experience symptoms like shortness of breath and fatigue. It's like trying to inflate a balloon that's lost its elasticity. It requires more effort and the balloon can't hold as much air. Airflow obstruction is a challenge. However, it can be managed. How can we manage airflow obstruction caused by pulmonary fibrosis, you ask? Well, pulmonary rehabilitation is an effective way to tackle this issue. This rehab offers a range of exercises and techniques designed to improve lung function. Breathing exercises, for instance, can teach you how to take deep, slow breaths, maximizing the amount of oxygen that reaches your lungs. Strength training exercises, on the other hand, boost your muscle health, reducing the demand for oxygen during physical activity. Another technique is pursed lip breathing. This involves inhaling through the nose and exhaling slowly through pursed lips. It helps slow your breathing rate and keeps airways open longer, making it easier for you to breathe. Then there's diaphragmatic breathing or belly breathing, which encourages full oxygen exchange by engaging the diaphragm, reducing the effort needed to breathe while slowing your breathing rate. Remember, it's always best to perform these exercises under the guidance of a trained professional. Managing airflow is vital, but what are the other treatment options? What are the treatment options for pulmonary fibrosis? When it comes to managing pulmonary fibrosis, there are several routes that medical professionals might suggest. One of the most common is medication. Drugs such as antifibrotic agents can help to slow the progression of the disease, providing some relief to the symptoms and improving quality of life. Another common treatment is oxygen therapy. This involves breathing in oxygen through a mask or nasal prongs to help maintain normal levels in your blood, making it easier to carry out daily activities and even improve your sleep. In severe cases, a lung transplant may be considered. This is a major operation where a diseased lung is replaced with a healthy one, usually from a deceased donor. It's a complex procedure with significant risks, but it can also offer a chance at a more active and normal life. Treatments are crucial, but how can you help yourself? What self-management strategies can help improve your health with pulmonary fibrosis? Let's dive right in. First and foremost, steer clear of smoking. It's a no-brainer, but it can't be stressed enough. Smoking can exacerbate your condition and hinder your recovery process. Next, embrace regular exercise. It can seem daunting, especially when you're dealing with breathlessness, but with the right guidance and a gradual increase in intensity, it can significantly improve your lung function. A balanced diet is another essential factor. A diet rich in fruits, vegetables, lean proteins, and whole grains can boost your immune system and promote overall health. Stay hydrated. It helps to thin the mucus in your lungs, making it easier to breathe. Don't overlook stress management. Techniques like deep breathing, meditation, or yoga can be incredibly beneficial. Lastly, adhere to your treatment plans. It might be tempting to skip a pill or a therapy session, but consistency is key. Self-management is a long-term commitment, and remember, early detection matters. Why is early detection so important in pulmonary fibrosis? That's a question worth exploring. When it comes to managing pulmonary fibrosis, time is of the essence. The sooner it's identified, the quicker the appropriate treatment methods can be implemented. Early detection allows for a proactive approach to managing the disease, potentially slowing its progression and improving quality of life. This is particularly crucial as pulmonary fibrosis is a disease that tends to progress over time, leading to increased scarring and decreased lung function. But with early detection, treatments can be started that may slow this progression. Moreover, early detection provides an opportunity to make lifestyle changes, such as quitting smoking or adopting a healthier diet, which can also play a significant role in managing the disease. Therefore, it's clear that early detection isn't just a matter of convenience, it's a matter of necessity. Knowing about pulmonary fibrosis, its triggers, symptoms, management, and the importance of early detection is the first step to better lung health.